to 12:30. We're going to go through all the technique in the dog. The basic anatomical identification is the same, basically. And what's the difference in the extremity on this animal, front and rear? What's the difference between this and this?
Numbers of toes.
Yeah. You see in the horse, see, all we got to do is go straight line. The bones are pretty much solid. They're solid down to the fetlock. See? But that's not necessarily the case here, is it? We have separate bones. Just keep that in mind because of the necessity of the carnivore versus the flight. This one just wants to get away from this one. So that's your difference really in the extremities here. Structurally, everything's pretty much the same. It's just you don't have a solid bone in here. You have two bones, right? You see? Versus one bone here. Cannon area. Cannon bone. Understand that? So just those of you not aware with that, that's your main issue between the dog and the horse. But elbows, shoulders, everything else is pretty much the same. It's just they can't be quiet. Okay, we're going to go over the technique. Now keep in mind the same thing here. This just laying in here. There's no clavicle here either. Just laying in here. See? And this joint, the shoulder joint, you see, there's no deep socket in there. It's just similar to ours. It's just sitting in there. Everybody got that? Have you already seen that? Just sitting in there. So if it's out of place significantly, it's probably an open dislocation. You've got to be very careful, mess around adjusting shoulders. Subluxated. All you got to do is put it through range of motion. On these shoulders, horses and dogs, you just go like that. Check them, and then a lot of times if they're out of place a little bit, they'll just slip right in. Okay, so keep that in mind. You don't have to go cranking around on stuff. Remember, the more surface on articulation, the less you need to be cranking on heavy. Deeper, heavier musculature, you got to get after a little bit, don't you? Right? Okay, those are some principles. So. So that scapula sits right in here. Well, do this okay. And this scapula at certain times and certain forces, not really injured by running straight. It can be injured by running straight if this is not correct down here. If we have stuff off down here, that sends the improper, unequal force up each extremity. And that's front or rear, by the way. And that's what causes a lot of these issues up here and up here. Not all the time, but I just want you to be aware of that. That's why. It's the biomechanical imbalance, sending improper force, unequal force up. Okay? And this, it happens much more, that type of injury, impact injury on the ground is much more critical here because this is 60% of the impact of the skeleton here, 60-40. Okay? This is mainly for push. This is mainly for push. This is not. This is just impact. Okay? It's where everything hits. That's why these joints are lateral here. That's why these are lateral and these are P to A. We already went over that. Okay? Okay. So this can ride up. You can also you can ride forward. It can rotate also. Okay? So I want to look over the withers. Take a look over the withers of these horses. They got to be pretty much square like this. You see? This is pretty square. Not 100%. The horse never been taught to be square. You can spend all day trying to get them square. Just look over the withers. Okay. Come down in there, and here's, of course, here's the shoulder. And here's the humerus. Right? What's this called?
Elbow.
Elbow. It's the elbow, right? Very heavy joint here. This humerus comes in to this radius ulna, like this. It comes in, the humerus comes right around it like that. And so it's very hard to subluxate this. If this gets injured, you better, and there's a lot of pain here, you better have some films taken before you mess with it too much. Okay? Remember, the more acute, the more severe the pain, the higher probability of a more severe injury. And if you just touch something and this horse wants to eat you, you just touch them, they want to eat you, you better think of more advanced diagnostics than palpation. Think about that, okay? The kissing spinous on horses, you touch them here, or fracture, you touch them here and they want to just drop on you. Dropping back here is one thing. This is different. But you touching up in here where the main weight bearing is and they want to drop away from you, that may not just be subluxation. All right, so here we are, shoulder is the elbow. Now what's this in here called?
Radius? Is that what you're looking for?
You want the bone?
Radius and the ulna fuse, right? The radius fuses till the ulna, 3 years old? It depends. Some of the warm blood is later. But the fuse in here, okay? Ulna, okay? Carpus, right? Now here's the deal. You see how this horse is presenting? Our anatomical presentation is this way. The quadruped is this way. Keep that in mind. So, we talk about the knee here, and we study the knee and the bones in the knee. The medial over here is the radius. You see? Is the medial aspect. There's a radial carpal bone. You see, there's 1, 2, 3, 4s, and there's names. But so keep that in mind. This is radial. This is ulnar side. Keep that in mind. Always note that it's a dog too. You got 2 rows here of joints. Okay. This baby here, you have an upper hock and lower hock. Okay. Same basic configuration, but this is there's more bones in here. Okay. Everybody see me?
Yeah.
Okay. This is called what? Cannon, right? Cannon. What else is it called? Metatarsal, huh? Carpal. Metacarpal. Yeah, metacarpal. Okay? It's a cannon bone. I heard that they got this cannon bone name from the Civil War. That the cannoneers, this is what they aim for on horses. To take them down.
That doesn't make sense.
I know.
I would think that it
But
was
I've
called
heard
a
that's-
cannon bone because it was long and...
Yeah.
Yeah. No, I was drinking. Anyway.
Okay.
Just remember that cannon story. That sounds good too. But they aim for the cannon bone, So this is the third. You see, and this is one bone, and this is one bone. You see, right? Okay. Now this is the fetlock. We got fetlocks here and back here, don't we? Fetlocks. Sesamoids are back here. Okay. Now here we got. From here on is the phalanges. We call them P1, P2, P3s on horses, but they're the phalanges. That's these babies. You got a long, intermediate, and you got a short. You got 1, 2, 3. Okay? The 3 is inside the hoof. Okay? There's a joint right here. This is not a bone. This is not a bone. This is a joint here. It's 2. It's right there. That's between 1 and 2. This is the pastor. Excuse me. Keep that in mind. You're checking for lameness and checking for stuff in horses. They're limping. Don't be looking up here necessarily. You got to start down here. Okay? You take a look at this pastern. If you see a pastern all swole up here, you check this joint. If it's larger than the other one, that's usually called ring bone. Ring bone. It should be, if it's human error and disuse, put a rode hard, put up wet, it'll be in both joints, both sides. You know, if it's an injury, a trauma, improper shoeing, or chronic subluxation, causing more weight on one side, it can be one side. Always take a look here, and you got to look back here, by the way, the suspensories. Make sure you understand that stuff, chiropractors. Make sure you understand about these. Take a look back here. Look at the symmetry in these suspensories, front and rear. Don't be diagnosed with a subluxation if we have a blown suspensory. Okay? There's upper and lower. Okay? You gotta take a look. That's what this. Static observations about before you go in and intrude and make a decision on what you're going to adjust. You got to take a look first. Take a look at the whole animal. Okay? All right? Any questions about that?
Where do you see the bowed tendons?
Where do you see them? I see them, well, right here primarily.
So the difference between the bowed tendons, which is the superficial and deep digital flexor, and the suspensory is where anatomically?
I don't even diagnose that. If I see it, that's a veterinary issue.
Okay.
It'll look like.
Yeah.
I mean, a bowed tendon will look like. I mean,
Be a
it'll
knot.
be like this. It'll
It'll
swell out.
swell out,
real big.
Yeah. Just by location. If I see it, I say, get your vet. I don't even mess with them. Chiropractors, you see suspensory issue like that, just get the vet out. You can't make any recommendations, anything like that. That's all veterinary stuff. That's why I make a line between veterinary issues and chiropractic issues. You always do that, you're always cool.
Do you think though that a bowed tendon is because the horse was out of alignment to begin with?
Can be. Not necessarily is it. It's case dependent. Can be. If it is, then the reason is more weight here. And I've seen it on improper angle here. I've seen it both.
So like improper shoeing, you mean? Or
Improper
just
trimming, not necessarily shoeing, trimming. Improper angle, heel toe angle. You see this pastern right here? This angle should go all the way to the ground. That's the law on trimming. It was LL. It's an opinion. Now it's not an opinion. You look in the books. This is the law. I mean, this should go all the way to the ground. You look at and the vets will tell you that you take a look at the X-rays. You take a look at coffin bone X-rays. Anybody ever seen them? If you haven't seen X-rays of this region, you need to look at them, chiropractors, because you get a real good idea of what things should look like outside on the surface. You don't want this angle to change here. Keep that in mind. This needs to be continuous. It's not always that case on all horses, but there's more of an angle here. This angle right here that you see is not in all horses. This is more of a quarter horse thing. Your walking horses will have a greater angle here. My big horse, you know, especially back here, this is definitely more of an angle here. The ligament flexibility and attachments is not the same on a walking horse or a carriage horse, by the way. Keep that in mind. So that's why you got to know the breeds a little bit. Now I'll be talking about hot bloods and cold bloods in the next hour or so. Everybody good with that? Chiropractors, you get back in suspensories and stuff, you don't know what it is? Fine. That's what the vets are for. Don't make a diagnosis, don't make an opinion. But if you reach down here and you touch a bowed tendon, and that horse comes up on you, it's tender, you probably have a positive for lameness. Limping or lameness. Now, if you come down and it's old, you can touch it and it doesn't cause any symptoms, right? Now you go out and trot them, come back, or do the flexion test, and then you touch it and it's sore. That's positive.
Does the sensory ligament swell like a bowed tendon, or is that more subtle?
Depends on degrees.
Well, yeah.
Depends on degrees. But it doesn't matter. If it's positive, you touch it. If it's positive, you're bothering a horse, you get down in here, it's going to bother them. If you want to question it, take them out and trot them out and come back and do that, check them, or bring the leg up like the vets do. Do that, check.
Would you adjust the animal or like the rest of the animal's body or before you'd send them to the vet? You saw like the both tendons and everything?
I check everything out, yeah.
Okay.
Yeah.
Okay. And then just
But don't be
say-
doing adjustments up here if you got a bowed tendon if it's positive.
Right.
Because you could have a sore scapula and be coming from the bowed tendon. Everybody good? Okay. This is an example right here, everybody, where this is the veterinarian mainstay. This is the big part of veterinary work right here. Big, 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 big. Big. Okay? All right. Well, what do I do about the bowed tendon? I should put the horse over there in the corral in the stall until the vet gets here. You mean I can't use them? Where's my gun? Are we all good? Yes? Okay. You see that? See how this scapula, this humerus is in the shoulder? Now back here, see, this humerus is in the shoulder, right? On the body cavity itself. You see that in our body central. And so is the femur. See, the femur here is right in here. See? Right? So it goes right down to the knee. Huh? Call it the stifle on the horse. It's kind of, I don't recommend you go palpating them like I'm standing here. That's not a good idea. I'm just, because I want everybody to see this. So it goes from here up to here, okay? That's the femur, right? Okay. So the actual hip joint, you come up the femur and you can feel the knot right here. Feel the knot right here. Femur comes up, you can feel the knot right here. Now, the hip joint is up in here, in there. It's not actually where the knot is, okay? Where the femur is. It's actually in there. So keep that in mind. So when the vets do injections, they do it right in there. Comes down in here. The only problem time you get femur problems is sometimes during parturition. Sometimes that happens. You get called up and the mare can't get up or the cow can't get up, and that happens, or they blow a lumbar out trying to push. So, things like that. And then here's your stifle or the knee, huh? Right? Any vets do injections here? Any vets do injections here? This is big business. Right? Big business. Not little business, it's big business. You do more here than you do here? Yes. Don't you?
Except for coffin.
Huh?
A lot of coffin joints. A lot of coffin joints.
Oh, coffins? Okay. All right. Okay. So here's the knee. And what's this? We said shin bug. All right, here we go. All right. That's this here. All right. What's that called?
Tibia.
Thank you. Thank you. Okay. And then here's the ankle. And here's the hock. There's the hock. There's the baby. That's the big push baby right there. That's the big push baby. These get definitely injured. This is the big stress more than this for pushing. Because here you have give here. You have give at this bone and this bone. You see? You see this angle right here? This is, when this hoof hits the ground and plants up here to push, the main force is coming right through this baby, right there. Not the only force, but that's where a lot of the problems occur. Because there's this lower hock joints that bones in it, individual bones, kind of like you do the knee. And that's the problem. Because it's actually, with the more joints you have more instability. Okay? Here it's pretty, here it's just hitting, this for hitting the ground. This doesn't really push. This is the big push baby here. Okay? So, the upper hock joint, no. You have to adjust that? Probably not. I'm going to show you how to do stuff like that, but it's so large it sits in just like this. If you got to adjust the upper hock joint, you probably got some other problems. Right? When you come down here, this lower hock, I'll go over that Sunday at the lab. You can check for crepitus in there. By the way, you need to check for crepitus if you're working on any performance horses. You need to be able to check for crepitus. You just put the web of your hand right here, and then you flex that hock up and down, and you can feel if it's crepitus or not. Okay? What's this called?
Cannon bone.
Cannon again, right? Where's that? What's this one? Metatarsal, isn't it? Right? Okay. And here's the fetlock again, you see? Same basic structure. And pastern again, same structures here, you see? We get a lot more, I see a lot more evaluations of coffin bones and problems in the front in this area than I do the rear, as far as chiropractic is concerned. You know, I see a lot more evaluations due to improper angles and stuff. I don't see a lot of farriers screwing up this angle as much as they do the front. A lot of screwing up here, proper improper angle. A lot more evaluations on coffin bones up there. Okay, does that help everybody?
Yeah.
Does that kind of give you any major questions from all this here? I'm not going to go by technique. I'm not going to go by all the findings and stuff. If a horse does this, he's got this. You know, if a horse does this, he's got this, or a dog, I don't recommend you evaluate that way. You ought to just check them all out. Okay? You think one thing causes something else, next horse ain't going to be. That horse may be smoking doobies, you don't know. That dog, I swear that dog is sneaking in something tonight. All right, now I want you all to just go ahead and palpate the dog and the horse. Kind of put your hands on there. If you never have done this, now that we're working on extremities, you need to get your hands on it a little bit, and let's get familiar.